Comment that when you are 20 years and above, as long as you are a Ghanaian,
Go and check.
at least every 2 years, have your eyes checked. Like if you check and it's normal, if you are less than 20 years, at least every 2 years. But from 30 years going, every year, have your eyes checked. If unfortunately there is any family history, if a close relative of yours has glaucoma, then you should be checking it much more frequently, at least from 20 years above going. But you know, there are a lot of other eye conditions that are silent. So I'll use this opportunity to advise our listeners that at least, no matter your age, once in a year, around the time of your birthday, have your eyes checked. Because like we say, the eye is a light of the body.
Yeah.
No matter your potential, no matter your skills,
If your eyes go,
if you are not seeing well, you become very
and I mean that is something to pay attention to. You know, I thought my eyes were fine. You know, I always thought that my eyes are perfect. My eyes are fine. Oh, I don't have a problem. And you know, I see people wearing glasses. I say these people they are suffering power. You know, then I wake up one morning and I can't read anything on my phone.
Yeah, I'm sure that was when you hit 40, around 40.
Everything on the phone suddenly became blurred. I just told myself in the morning, maybe I had a bad night. So, you know, let's move on. Went to the office and then, I mean, they brought me some things to work on. And I was reading everything like this. So then my HR was like, is everything okay? Why are you holding the paper that way? I said, no, I just want to hold it that way. He said, no. The eye clinic, you know, we have an eye clinic. So let's go to the eye clinic and go and check. So I was very adamant because me, I can be stubborn. I said, no, I won't go. I can read. Then later in the afternoon, I said, okay, you know what? The eye clinic is a bit calmer now. Let me just go and indulge myself. Let me just check.
Yeah.
Because I know my eyes are fine. Because then I could read on my phone. And I went to eye clinic and then they put that thing that you guys put on our eyes.
Yeah.
And then everything changed. Yeah. I was shocked that I was walking around and could not probably see properly.
Yeah. But you thought that was normal.
I thought that was fine. And it's for me, it was such a huge realization that I should have probably done this probably a year before, and I had been straining. So, listeners, I'm saying this so that you listen. Just go and check. Just check. Like Louis said, if there's nothing wrong, there's nothing wrong.
Yeah.
But just check. Dr. DUOPA, is it painful or difficult or complicated to do an eye test for glaucoma?
No, it's not painful.
Okay.
It's not difficult. It's just a regular eye check. We just put some lights in your eyes. You look into a machine and we look at your eye. Some people feel a bit of discomfort because of the lights, but apart from that, it's not painful. It's not complicated. It's not difficult at all.
Okay. You don't bring some huge machines to come and look inside our face?
No.
Okay.
No, it's just a small, like, microscope, if I should put it that way, just to make the eye look bigger, that we can see the details. Yeah, so it's not painful. It's not difficult.
So to anybody who is thinking that the eye screening is going to be painful or uncomfortable, you have Dr. DUOPA's assurance that it is not painful. Yeah. It's not going to leave you feeling like I shouldn't have done this. Okay. But does it take a long time to do that?
So the screening itself doesn't take a long time, but generally eye clinics have a lot of patients, so the waiting time, that is the issue.
But during this screening, when it's going to be quick.
Yes,
I mean,
quick.
listen, even if it's 30 minutes, go and spend it on your eye.
Yeah.
Because if you go to a restaurant and they say wait for your food, they can take 30 minutes. So just spend the time. And thankfully now we have a lot of business savvy eye doctors all over the place, and you can just go and get a screening. Like walk in and get a screening. And what I like about the eye society is that when they say this week is glaucoma week, everywhere you pass, you see somebody with a banner somewhere and saying that they're screening. So go and get screened. What will you be looking for when you're doing the screening?
So during the screening, first of all, we let you read to see how far you can read. That's the visual acuity.
Okay.
And then
that's the one that you put some E and some things there.
Yes.
Charlie, I've seen some people reading that thing, and where I'm sitting, I can see everything. And the guy is B, but he's saying G and
yes. Yeah.
Okay. So you do that?
We do that, and then we look at the eye, examine the eye with some light. And in the eye, there are various parts of the eye, so we examine all the parts. Yeah. And then we also check the eye pressure.
Okay.
Yeah, to check if it's normal or it's high. So basically, that is the general screening. So when we look and then your eye looks suspicious of glaucoma, then we let you go ahead and do some further tests. Yes, and those ones will help to confirm or whether it is glaucoma or not.
Okay. Okay. So it's a fairly straightforward process, isn't it? It doesn't take a lot of time to get it done.
No.
Okay. Someone wants to know what are some of the things that causes pressure on the eye? Can something cause pressure on the eye? I just want to know.
Yeah. So the eyeball has some fluid in, we call the aqueous humor. That fluid must be within a normal pressure, usually for most people between 10 to about 21.
Okay.
If the pressure is so low, just imagine football that is not well pumped. It will not have that normal shape that makes it like a football. So if the eyeball too doesn't have that normal pressure, it means the eyeball is going to shrink. Okay, but however, if the pressure is on the other end, like higher than it should be, then it puts the optic nerve that is located at the back of the eye at risk. That is what caused the damage that we call glaucoma. All right. So there are many things that can cause the pressure of the eye to increase. Normally, where that fluid is produced, the fluid helps to nourish certain components of the eye. After it has done its work, it's supposed to drain away from the eyeball. There is a place, a sieve-like structure within the eye. We call it trabecular meshwork. As you grow, sometimes this sieve-like structure, there is a lot of resistance within it. So just imagine like you have a sink in your house. The sink, when you put water in, it flows very well, but with time, the water doesn't flow very well. All right. So when it comes to glaucoma, that sieve-like structure in front of the eye, okay, when that resistance increases, it means that the rate at which the fluid should drain out of the eye is lower than the rate at which that fluid is being produced, and that will cause the eye pressure to go high. This is a silent condition in most people. However, there are certain conditions that can cause the pressure to also go high. For example, when something hits your eye, if there is trauma to the eye, the inflammation that goes on within the eye can cause the outflow pathway to close up and cause the pressure to suddenly go up. Certain medications like steroids that people use as eye drops or that people take for many different reasons, orally, some of our topical creams that we use have steroids. All of them can have side effects that can cause the pressure within your eyeball to go up. So these are some of the conditions that can cause your eye pressure to.
So there are things
rise.
that you can do that you do that can cause your eye pressure to go up, and it's good for you to hear this, and it's good for you to know this. On the same line, does excessive reading or looking at screens affect our eyes in such a way that we can get glaucoma? This is a question from a listener.
No, it's not been known that, because the eyes are meant to be used. So reading excessively that doesn't cause glaucoma. It can cause your eye to fatigue. There is a condition we call dry eye syndrome, computer vision syndrome, and all that. So sometimes if you do a lot of near work for a long time and you don't take regular breaks to rest your eye, the surface of your eye can become very dry and very uncomfortable. But that in itself does not cause a pressure within the eye to rise. There is another condition which is very important that I forgot to mention.
Sure, go ahead.
People who have systemic conditions like hypertension, and then diabetes, they are also at risk of having their eye pressure go up. And this is how it happens. Sometimes these conditions can predispose the blockage of certain vessels within the eyeball. So if there is a blockage, more like a stroke within the eyeball, if there is any blockage of some of those small vessels within the eyeball, it will start some process that the eye will want to restore blood flow. And in that process, certain substances are produced within the eye that cause that angle to close up. Certain abnormal new vessels are produced, and that will cause a secondary kind of glaucoma and cause the eye pressure to rise so high. And this kind of glaucoma will not be silent. There's a kind of glaucoma that will send you to the emergency unit. But that is not very common. So just for people to be aware
that being hypertensive or being diabetic,
it's also a risk.
Also increases
if it's
your
not
risk.
well controlled.
Yes.
It can increase the risk of you having a secondary kind of glaucoma that can even be more devastating than the primary open angle glaucoma we are talking about this week.
Good morning to you, Rita. Rita is saying that when we were younger, one of the things that our parents and our grandparents say to us is, don't sit too close to the TV or else you go blind. Kindly ask your doctors if this is true. Dr. DUOPA, you were laughing. People still say it. We haven't stopped saying it. Yeah, they say if you sit too close to the TV, when you befra.
Okay, so generally, it's not true. Yeah, sitting too close to the TV doesn't cause blindness, but like Dr. OTENG said, it's basically got to do with the computer vision syndrome and the dryness of the eye and straining of the eye, but generally it doesn't cause blindness.
And it's not advisable to sit too close to the TV.
Yeah. And I think there may be some association, but not as a cause. For example, when growing up, if a child doesn't see very well from a distance, that child normally will get closer to the TV to see clearly. If you see that, it's a sign that that child needs to have the eyes checked. Maybe the child could have refractive error or myopia, which itself is also a risk for glaucoma. So they may have seen that, this child who is always close to the TV, later the child became visually impaired or blind. But it's not the sitting close that caused the blindness, but it's because the child has an eye condition that needed to have been attended to. That if you don't send the child that you see that kind of behavior to the eye clinic for thorough eye checkup, that is what will lead to maybe blindness or visual impairment later in life. I'm not sure whether it's clear. So
I understand.
It's an association.
It's an association,
but that's not the cause.
It's not the cause.
Exactly.
But I mean, the general public advice is don't sit too close to
exactly.
the TV. Don't sit too close to the TV. Or Dr. Loretta, isn't it?
Yes. So like Dr. Louis said, if the kids are sitting close to the TV, that should prompt you that there's something wrong. So let's get their eyes checked.
And I mean, trust me, when kids go to eye clinics, they are very happy. It's a fun time for them.
We have toys for them to play around.
And when you mount that thing on their faces, it's a whole new experience. Yes, I like that when I went to my ophthalmologist's place. I mean, the kids had a good time. And they kept asking, when are we going back? I said, no, we're not going back. We're not going back. We'll go back in a year's time. Yes, because it's important that if you're listening, kindly have a routine for yourself. Like Louise said, a good time to do it around your birthday so that you don't forget is important. You know, you check everything from head to toe. And on your head, the first thing that you see are your eyes. So try as much as possible to get that in. Don't think yourself a Superman. Your eyes can also have a condition that will cause you to lose your sight as you age, and it can be devastating. And like my guests have just said, it's even happening in younger people. So it's good that you keep an eye there. But as glaucoma cannot be cured or reversed when it reaches a certain stage, that means that the medication use is lifelong, right?
Yeah, that's something that's I mean, with this opportunity, we want people to really understand. Yeah, blindness from glaucoma cannot be reversed, but having glaucoma is not a sentence that you are going to be blind. So there are many ways of treating glaucoma. The aim of treatment is not to reverse the vision that you have lost.
Okay.
Is to try and protect the vision that you have
that
left.
is left.
Yes.
So don't when you are told you have glaucoma and that's the cause of probably your challenge in sight, it doesn't mean that the medication you're going to be giving is going to bring it back to your pre-glaucoma state.
Exactly. Some people may have some slight improvement because there could be other reasons other than the glaucoma. That's why their vision is low. Like somebody who is old may have some cataracts or may have some refractive error. That's targeting those or managing those conditions in addition to controlling the pressure may improve their vision a bit. But the actual vision that has been lost from the glaucoma in most cases cannot be brought back. And this is what most people don't understand. So someone will go to clinic A, he's given a set of medications. Because he's not seeing an improvement in the vision, he may stop the medications or maybe move to another facility and keep shopping or hopping from one facility to the other. Glaucoma is actually a progressive disease. No matter what you do, it progresses. Our role as ophthalmologists is to slow down the rate of progression so that you do not entirely lose your sight. So just imagine like you are in an aeroplane and something has happened. You have to get off the aeroplane mid-air. If you are getting off the aeroplane in high up in the sky without any parachute, what will happen? I'm sure
it is finished.
Exactly. However, if you know how to use a parachute and you have a parachute, I'm sure people who have been trained can safely get off the aeroplane without any terrible consequence. So someone who has glaucoma, it's like if you don't do anything, you are going to be blind. But with the treatment that are available, i.e. eye drops, or that's the medical therapy, we have laser treatment for glaucoma, and we have surgery. It depends on the kind of glaucoma. It depends on who we are seeing with the glaucoma. It depends on the stage of the glaucoma. That is what determines which kind of treatment will be appropriate for that particular eye or for that particular person. So for most people with glaucoma, we start with eye drops, and there are different kinds of eye drops. They all play different roles. Some of them depend on how high the eye pressure is. They may need one eye drop, some may need two, some may need three, some may need four. And all these 3, 2, or 4 medications have to be used together. So sometimes you see a patient is on 4. Your doctor has seen that you need these 4 different classes of eye medications to keep your pressure low, so that the remaining nerves are safe. If one of them gets finished and you're using just the remaining 2, the aim is not achieved. There's a reason why a car has 4 tires. If one of the tires is not in good condition, the car cannot move.
Exactly.
Yeah. So when it comes to medical therapy, it's very important. Patient has to be aware and then stop this habit of shopping from one clinic to the other. If you have gone to a place where your doctor has explained things well enough for you, you have to understand the condition and then comply with the medications.
Yeah.
Sometimes there are challenges. If you are using the medications and you have side effects, go back to your doctor. The doctor may change the medication. If the doctor sees that maybe the medications are not helping because of side effects, there are other treatment modalities.
Other options available.
So we call something selective laser trabeculoplasty. It's a laser machine that we use to increase the outflow of the fluid within the place that I said there could be resistance. And at first, we didn't have these kind of lasers in Ghana. But now we have some. At Confanosh, we have an SLT laser machine. At JACHIE, where I work, we also have one. If you go to some places in Accra, they have some. Okay, so there are certain kind of people who qualify for some of these treatments. If the drugs will not help, that's an alternative. There are some people that the drugs and the lasers may not help. They need immediate glaucoma surgery. And we have different kinds of glaucoma surgery that have been proven to work. They work by helping to control the eye pressure to a level that your remaining optic nerves are safe. And with good monitoring, we can prevent the eye from becoming blind from glaucoma. So I want to maybe add that because we are all uniting, we have many cadres in the eye health. We have optometrists, we have ophthalmic nurses, opticians, and we have ophthalmologists. Most people, when they are around 40 years, like the condition that you described, we call it presbyopia. Most people from 35 to about 45 years, your near vision becomes impaired because your lens at that time has become a bit more rigid. It's not able to change its shape for you to focus on things that are close to you. All right, so you have to push the thing far away from you before you can see. So most people, the first time they may go to an eye clinic will be when they notice that now they cannot read.
This is me.
Yes, now they cannot read. And that offers us a very great opportunity for us to screen people for glaucoma. So my advice to some of our colleagues, wherever we find ourselves, is that when someone comes to the eye clinic for any reason, because of the high prevalence of the condition, please spare some few minutes to look at the back of their eye, look at their optic nerve and check their eye pressure. If you notice any abnormality, please, if you cannot manage the condition, because management of glaucoma, like you said, is lifelong. It's not something that you give treatment for a month and that is all. Okay, so sometimes you find some people who are young. If I find a young person like in his 20s who has glaucoma, and then I'm treating the person with medication, sometimes patient forgets. Sometimes they don't have money to buy the drugs. Okay, like this guy who is in school. In school, some of the drugs they may have to put in refrigerator. So just imagine the constraints with managing such a person. And the disease will not wait for you because you are in school. Every hour matters. Every day matters. So by the time this person is done with school, there's a lot more damage that cannot be reversed. All right. So every glaucoma patient must be seen not just within the time that you are seeing, but think so many years into the future. Would the treatment that I'm giving to this patient now be able to prevent the person from becoming blind in 5 years' time, in 10 years' time, in 20 years' time? So that if I think there are better options, I should quickly refer the patient to a place like Confanosh, where we have specialists who are only focusing on glaucoma, so that they can manage the patient in total. When you have the input of such a specialist, patient can even go back to you. You can monitor, and once in a while, patient can come back for these inputs. So that is something that I want to put across.
I think it's important that colleagues realize that referring and back referrals are normal in any system. You can send the patient across to be seen. You can contact the doctor for their treatment plan and what protocols they are using, and the person can come back to you and then you follow up. This is the Health Lounge on Orange 107.9 FM. We're talking to Dr. LORETA DUOPA and Dr. OTENG as we mark World Glaucoma Week. Dr. DUOPA, I have a question from Evans. Evans is asking that, he's saying that all the medications in the eye clinic look the same and smell the same. Can you ask your doctors why this is so, and how do we tell them apart? You're saying that all the medications you give for eye conditions, they all look the same. Do they? I don't even know.
The bottles are the shape.
The shapes
is the same, but
okay.
usually there's a color code, and the color of the cover changes for the various groups of medications.
Okay.
Yes,
okay.
that's the main difference.
That's the main
difference. Also the name on it. Yes, the names are always different.
Okay. Yeah. So Evans, you have to pay attention to it. And okay, so he comes back by saying that the explanation of the use and the times of the medication sometimes confuses us. Is there a simpler way to administer eye medications besides dropping it obviously in your eyes? That's his question.
Simpler way. The simplest way is to drop it on your eye.
You don't have any tablets or pills for them?
We have tablets for various other eye conditions, but
not glaucoma.
No, for glaucoma, even the tablets are temporary. You can't use it long term because of their side effects. So mainly, the drops are the main long term treatments.
Okay.
Yeah.
So it's are the drops given at some particular times in the day?
Yes, it depends on the type of eye drop. Some are used once a day at night. Some are used twice a day. Some are used 3 times. Yeah.
So what happens if maybe I'm supposed to use it at night and I forget? Can I quickly use it again?
In the morning?
Yes.
No.
You can't. Okay, Evan. So that's your answer. You have to adhere to the protocol that you've been given with the medication. You know, it's not easy, is it?
Yeah, it's not. I understand. It's quite difficult. But let's say if you have been given a specific time, like maybe you're supposed to use it 3 times a day, but you forget the afternoon one. Whatever time you remember, you can drop it. You can use it and then delay the evening one a bit more. Okay. Yes.
Okay. Yeah. I think Evans is a client at one of your eye clinics. He says, kindly ask Dr. DUOPA for me, where should we put the eye drop? Is it in the corner, on the eyelid, or where?
Okay.
So Dr. DUOPA, can you take your time and explain to us? Yeah. Where should we drop eye drops?
Okay, so you can put it in the corner.
In the corner, close to your nose. Okay.
Not
yeah.
In the corner.
Okay.
Another way is you can depress the lower eyelid.
Okay.
And just drop it on the eye.
Okay.
Yes.
Okay.
Or you can just put it directly on the eyeball.
Yes, that's what people do. They tilt their head backwards and then
put it directly on the eyeball.
But that one, I think it's easier when someone is doing it for you. If you do it yourself, it will end up all over the place. Yeah. Okay. So Evans, you see, there's a system to it, and it's good when I bring the experts here. So she has taught you the ways. You either tilt your head, you depress your lower eyelid, or in the corner of your eye, you drop it. And sometimes they say 2 drops, right, in both eyes or something. The thing to I'm pressing, I may overpress. I may overpress it. Okay. Good morning to you, Nanekia. Nanekia is saying that I administer. Okay, she administers her grandmother's medications, and she's saying sometimes one will finish before the other. Ask them, what do we do when one finishes before the other?
I think that's the point that I emphasized earlier, that there's a reason why your doctor has put you on 3 eye drops. They all have their different mechanisms of action. Okay, so it's been known that for you, as your level of glaucoma, with a level of pressure, you need drug A, B, and C to keep your eye pressure under safe control. So if one of them gets finished, let's say 2 weeks before your review, and you wait and use only the other ones, it means during that period your eye pressure control is not optimal. Okay. So that is an opportunity for the glaucoma to progress more during that particular period. So normally, we advise that patients should have backup of their eye drops. If you are going to have a very long review period, either you have more bottles so that when one gets finished, you continue immediately. There shouldn't be any break. Or immediately, like when it's about to get finished, you make arrangement to get some before even your next appointment at the clinic. That is, if you have been told it is glaucoma and you are going to be on these drugs for a long time. Drug adherence is not easy. Like my Dr. Loretta said, it's not easy. So for those who, for certain constraints, whether they forget or whether side effects of the drugs or sometimes costs of the drug, glaucoma is actually a very expensive disease. Because just imagine if you're on 2 or 3 drugs and every month, insurance, I think the drug I'm aware insurance covers is Timolol and Latanoprost. But looking at the kind of glaucoma we have in Ghana, those 2 drugs are not enough. You may need some additional drugs. If you are on certain other class of drugs, on average, it could cost you almost around 200 to 300 cedis per bottle, and you use it only for a month.
Wow.
So just imagine, in addition to what insurance provides, if you have to spend about 300 cedis on just that particular eye drop, and it is not for 3 months, it's not for 1 year.
It's 1 month.
It is for, you are
using the drug
for your lifetime.
life.
Just imagine. All right. So we make certain considerations. There are some people you can see that economically they are not very well placed. They may not be able to afford the drug. I mean, all the time. Or sometimes they may have the money, but the drug may not be available where they are. So for those people, that's where we have to think outside the box and look at some of the other options of glaucoma treatment that will help them. So some of them, we advise early glaucoma surgery.
Okay.
When the glaucoma surgery is successful and you are fortunate, you may not have to use all the numerous eye drops, maybe just 1 or 2.
Okay.
Or sometimes no eye drop at all.
At all. Okay.
All right, especially if you are a young person. Yeah. When it comes to glaucoma in children, like the congenital glaucoma we talked about, that one, the treatment is not drugs. It's not eye drop. We may give you some eye drops or some medicine to take. It's just for a short period whilst we are waiting to do surgery for you. Because the main mechanism behind glaucoma in children is because that angle where I said the fluid drain, it didn't form well. So the eye drops is just a temporary measure. We actually need to go in and open up those angles to keep the pressure of the eye low. Because in a child, the eyeball is still growing. It's soft. As the pressure increases, the eyeball becomes big and it stretches the clear part of the eye, we call the cornea, in the front of the eye. It stretches, and sometimes it can cause tears and scarring within that particular cornea. That can permanently cause loss of vision, in addition to damaging the optic nerve at the back of the eye. All right.
Okay.
So glaucoma in children is mainly a surgical disease.
Okay.
Eye drops may have a role, but it's mainly surgical.
Surgical.
For the people who are older, there could be other options, like mainly the drops that we are used to, the lasers, and then surgery as well. If the disease is very, very advanced, we know that eye drops, 2 to 4 eye drops cannot bring your eye pressure down to a level that we think is enough. It is an indication that you should have surgery as early as possible.
All right. If you're just tuning in, this is 107.9 Orange FM. You may have missed some part of our conversation this morning with my guest as we discuss glaucoma in anticipation of World Glaucoma Week, and they're trying very hard to work towards a glaucoma-free world. And I know it's Saturday, and on Saturday everybody wants to do their laundry, everybody wants to get their clothing clean. Sometimes probably you're listening and you're now taking down your curtains or dragging your carpet out of your hall and thinking, where can I take it to? Let me tell you about Spin City Laundromat. At Spin City Laundromat, they wash, dry, and fold your clothes in under 2 hours. They take laundry from homes, from hotels, and from restaurants, and they have brand new machines that give your clothes a sparkling clean finish. And when they're done, they'll put them in these very nice Spin City laundry bags. At Spin City, it is one customer, one machine. They will not mix your clothes with any other clothing every single time. And here's what they're offering. From now, we're in March? From now till 31st December, they are doing their free after 9 promo. And what they're saying is, wash your clothes 9 times with them at any branch of Spin City and get the 10th watch absolutely free. They are open daily from 8 a.m. to 8 p.m. and they have branches all over. In Accra, you can find them at Ashale Boche, Lakeside, in Dansoman, they are at Akoko Photo. At UPSA, they are in the Prestige building. At Teshi, they are at Teshi Tebibiano. In Kaneshi, they are behind the Kaneshi police station. And in Kumasi, find them here at the Kumasi City Mall next to ShopRite. And also at Aidiasi, they are adjacent to Check City. At the Kumasi City Mall, you can call them on 055-445-5314. And at Aidiasi, you can reach them on 059-577-7371. Call them down, let them handle that laundry. Spain City Laundromat, wash, dry, and fold in less than 2 hours. Let me open the phone lines now. You can give us a call on 0541-022-318. If you've got a question for my guests, they are here. They'll answer them for you. 0541-022-318. Nana Kusa is asking, at what age is it appropriate for children to go for eye screening? Okay, he's a pediatric ophthalmologist.
Yes. So for children, actually, the best age is soon after birth.
Oh,
yes.
Soon after birth?
Yes, soon after birth. When a child is born, we are supposed to check their eyes. And then before the child starts school, we need to have their eyes checked. And then when a child is around like the preschool, between 3 to 5 years, you should have their eyes checked. Unfortunately, we don't have the systems in place to do that. If you go to the advanced countries where they have more people and they have very good screening systems, every child, there is no child who is delivered in a hospital who will be sent home without having the child's eye checked, because there are certain conditions that affect the eyes of children that when it's found early, it can be managed and prevent blindness in a child. When a child is when a child becomes blind, just imagine how long that child is going to live with that condition. A child who is blind or not seeing well will not develop well, because even when it comes to learning, almost about 80% of our learning takes place through vision.
Yeah.
So elsewhere, children's eye conditions are highly prioritized. All right. So beyond that, when the child is in primary school, at least every 1 to 2 years, even if the child has not doesn't have any complaints with the eye, the child should have the eyes checked.
Eyes checked. Okay. So
when it comes to glaucoma, like I said, in Ghana, I will advise that if you don't have any problem at all, if there is no issue with your eye, at least from 20 years going, have your eyes screened. You can peg it around the time of your birthday. So that you don't forget.
Okay. I have to pick this call, but there's something happening. I think I'll fix it after the call ends. Sorry to the person who just called. Tiny challenge with the setup, but let me, okay. So I think it's been fixed now, so you can call back. But let me ask this question as well. Someone is asking, Nana is asking, that my toddler has small eyes, which are clear, but whenever she's out in the sun, I realize she cannot tolerate the sun. Is this something that she should worry about?
If the eyes look smaller than usual, that could be a sign that the child needs thorough eye examination. Because when the eyeball looks smaller than usual, it means that the structures at the front part of the eye are crowded. So the pressure could go high, or there could be other issues like refractive error. One thing I would like to pass across to our listeners is that if a child who is less than 3 years, the brain is still developing. The part of the brain that is responsible for interpreting what we see. It's still growing.
Okay.
Hello.
Just a minute. Let's talk to this caller. Hello. Good morning.
Morning. But you're from Gabriel. Because it's 3 years until now.
Yes, Gabriel.
But you're no Glaucoma. I mean, you know, I say, the big band, the cry means me. And so, drum the man, and you saw during the dome chairman.
OCCC, no, a drone. Yet the man who is in the senior chair now.
But you're
in so one day.
But you're
okay. You, but you're on B1. Why?
But you're
you, Miss Medasi. 0541 022 0541 022 So that's what he's saying, that he has been diagnosed with glaucoma, but he cannot still see, more or less. Yes.
Yeah. So, like we said, the damage done by the glaucoma cannot be reversed.
Okay.
So at the time when we are managing or when we are treating, we are trying to preserve what is left. There are some people that maybe at the time we are seeing them, the glaucoma is almost end stage. We cannot perform miracles by bringing what is left. However, we do not give up on you. People who have very advanced stage, there is what we call low vision rehabilitation. That is medically, surgically, with spectacles. Not much can be done to improve your vision. However, there are certain specialists. We have certain people. Some optometrists have been trained in low vision rehabilitation that we can refer you to. Some of these people, they can help you with certain devices, magnifiers, telescopes, okay, and certain adjustments within your peculiar environment that can help you cope with the very little vision that you have left. You may be using the eye drops and not seeing any improvement.
Yeah.
That is not a reason to say stop. If you stop, the little that you are seeing that you are not even happy about, it will also go within a short while. All right.
I think that, Louis, that is the understanding that we need to get people
exactly
to. That's like you've been saying. The medication that you are being given is not going to, I don't say improve the eyesight. It's just it's going to preserve what is left. What is gone is gone. You are not going to get it back. Okay.
And that is not so good news to most people.
Yes, because
they
walk
to
you looking for a cure. Because if I lose my peripheral vision, and there's a car background, I mean,
exactly.
Okay.
Exactly.
Somebody sent a funny comment earlier that don't screen just the taxi drivers at the Bantama roundabout. He's saying add the Chocho drivers at the G roundabout, because some of them don't have peripheral vision.
It's terrible. You know, I once saw some commercial bus driver, and I was amazed. How is this person able to drive? Advanced glaucoma. One eye is gone. Yes. So when the Ophthalmology Society of Ghana decided to this year pay attention to drivers, I was happy.
Yeah.
Because you see, you can be driving safely yourself, but the person who is driving towards you, you have no idea how the person sees. They can knock people down very easily, because like the person who was crossing was not in their field of vision. They realize it only when the person comes into their central area.
Gosh.
So it's actually a very devastating condition.
Hello, good morning.
Morning.
Yes, please.
I'm Julia. I'm calling from Ovi.
Okay, kindly go ahead.
So I heard that if you have glaucoma, you have to use eye drops forever. Is it true?
Okay, you heard that if you have glaucoma, you have to use eye drops forever.
Yeah.
Okay, you want to find out if that's true. Okay, all right. Thank you very much for your call. 0541 022318. I almost said my phone number. 0541 022318. So that's a question, Dr. Loretta. She's heard that if you have glaucoma, you have to use eye drops forever.
Auntie Juliana, yes, it's true. It's true, because glaucoma is a chronic condition, like the way hypertension and diabetes is. You have to use your medications forever. And you don't have to stop, not even for a day, because even if you stop for a day, it worsens the disease. It makes your nerves die faster. So you always have to use the medications.
Okay. Lawrence in Swami is saying that, good morning, doctor. I say thanks for the education. He's saying anytime I look at a white light, I see a ring of bright rainbow colors around it. Also, my eyes are watchy when I'm happy and want to laugh. He says, I'm saying that it's very frequent for him. So it's two questions in one. The first one, when he looks at white lights, then he sees rainbows.
So I'll come to this, but let me just add something little to the previous way. So for people who are terrified about using eye drops for their lifetime, discuss with your ophthalmologist the other options. Do I qualify? So for such a person, maybe if the eye qualifies, for surgery, it will be a better option, because if the surgery goes very well, then the person doesn't have to use all the plenty eye drops for their lifetime. I've seen people who have had glaucoma surgery about 20 years ago, very well done, and up till now, their pressures have been kept low. Their vision has been preserved. Okay, for those who are not good candidates for surgery, or who may not want surgery, you have to decide what you have signed up to. Unfortunately, there is no other option than to stick to your eye drops all the time, judiciously. So otherwise, you lose your vision.
So it's good for your doctor to give you those options.
Exactly.
Because also using eye drops forever there. And easy, sir. And then
to the substantive
Lawrence's question.
Lawrence. We have seen that sometimes in some people, their eye pressure acutely becomes high. Like those, you see, we said we have different kinds of glaucoma. We have what we call angle closure. That one, suddenly the eye pressure becomes very high, and then there is a clear structure on the black part of the eye we call the cornea. The cornea becomes a bit hazy. So when light is entering, especially if you look at the white light, when light enters the eye, the light gets dispersed into its component colors, and that's why he sees the rainbow. So that's a sign. It could be a sign of some other kind of glaucoma. The eyes need to be checked. Maybe the angles are narrow. So especially during the evening, or when it goes into a dark place and the pupils are opening up, the angle closes and the pressure increases. Okay, or there could be some other reasons. So I'm sure he should have a thorough eye check so that we can find out exactly why that happens. That is what I can say.
So Lawrence, I think it will be good for you to go and get your eyes checked, and then the frequent tearing too.
So usually if the pressure of the eye is high, or the cornea is edematous or is stretched, the surface of the eye can become dry. If the eye becomes dry, the brain senses it, and then there is a reflex for the eye to produce more tears to keep the eye wet. So the tearing could be as a result of problems on the surface of the eye. That can all be treated when it's thoroughly evaluated.
Dr. DUOPA, does squint eyes cause glaucoma?
Okay.
There's a question from a listener. Does squints cause glaucoma?
Okay. So generally, squints on its own does not cause glaucoma. Okay. But squints is another condition on its own that can be associated with other conditions that can cause glaucoma. Yes. Okay.
Let me pick this call. Hello. Good morning.
Good morning, Dr. GYIMAH.
Yes, Kobe.
Doctor, your problem on Ambassador Susun maybe Ambama advice like me what primary no many city me chance as a adiabati no many kata to see the tower of paper and sanate. But me do JHS no man who be and I me they call MVTI. So you call workshop near so sort na just a welding and carbon need to tall many to say you bo jama to no. So tall many no was a me court check for screening. The course be any so be me tini sekuru or see no cause I'm some yin and I'm passing and no mammy eye drop. Me the best ye the goose still having the goose one I am ya more enemy jay so now no se me phone me the too higher me need me ya me denya and me tisa me di too low pa so me hu bibia kre ba sa me tise ekuro wo so ye me ya so any me problem timuni nya me nya
you me that's a plan. So doctors. Yes.
Yeah. And see, the other describing no possibly due to dry eyes.
Okay.
Yeah. And also sometimes treatments no and yeah sudden. Say we use a journal a call completely. It takes time.
Takes time.
And then so no sometimes too it doesn't sometimes the treatment itself the side effect of it is also causing the dryness. Treatments no yeah one time say we use to a journal now once there no way improvements there be it will take time. It will take time. And the fact so you so a journal any yano it's all go back to doctor now or trauma no so that's if there are other options or the bemano.
But like he's saying, he had a what sounds like a burn injury.
Yeah.
He says he was using a welding machine and something hit his eye, so he felt that intensity.
Yeah.
So all that predisposes is one of the what might likely have predisposed him to the dry eye.
Okay.
And
so,
again, I think on that, let's use the opportunity to tell the general public. We say prevention is better than cure. Certain activities or occupations predispose us to certain eye injuries.
Yeah.
So we always advise our welders, our carpenters, always you should wear your protective eye goggles.
Let me tell you something about the carpenters. He will have the protective eye goggles, then he's here.
Yeah. Oh, yeah. Or they are told in the moment.
Like he's wearing the thing. It's like he's not wearing it too, or share.
Yeah.
But at the moment, so.
Yeah. You know, I think maybe sometimes, like those who are around 40 and have presbyopia, some of the goggles, when they wear it, they don't see clearly at near.
Oh.
Okay. So maybe they may not be using the appropriate ones. The appropriate ones, if you discuss with your eye doctor,
they'll
they may
give
be
you
able to get some
ones.
correction in there so that you can wear it and still be able to see clearly when things are near.
After the welders, you see the guy holding the shield, the welding shield.
Yeah.
Oh well, then I know way.
Yeah.
We are not there. Say.
Yeah.
I'm like, no, it's the other way around. You're supposed to know where you're going to weld and then cover your eyes with it.
Unfortunately, I've seen someone, for some reason, one eye was not good. He had lost vision in one eye. And human eye, and so it's exposed the only eye to injury. As a carpenter, a nail came to poke the only good eye. Just imagine. And this person, because of financial reasons from some remote place, came to us when it was already very late. Very late. A very, very sad story. So always, there are, even aside those who do certain activities that predispose them to injury, that there are reasons why we have two eyes. When you have two eyes, your field of vision is wider than if you have only one eye. If for one reason or the other, one eye is not good, you must always wear what you call protective glasses.
Protective glasses.
Yes.
Okay.
So that if someone throws something that accidentally could have hit your better eye, the glasses will save you.
Yeah.
Sometimes you are picking something from the floor, there could be something sharp.
Yes.
Because your field of vision is narrow. Okay. If you are not wearing protective glasses, by the time you realize you have injury to that only eye as well.
But Louis, let me ask you this: you and Loretta are all in the business of eyes.
Yeah.
Now I see some yellow shade glasses that people have told me that is good for driving at night. Is there any truth in that? Like I've seen them around. I've seen people wearing them. And I ask them, why are you wearing? So, driving and enjoy a wow. I don't know whether that is.
We have different kinds of glasses tailored to meet the needs of particular people. There are people who experience glare. So for their spectacles, if they need spectacles, they will have these anti-reflective coatings. They will have certain tinting.
Okay.
You know, I talked about even low vision.
Please, just before we continue, let me. Okay, the call has ended.
Okay.
Sorry for picking it late. You can call us back. Sorry, it was just a mistake.
Yeah, there are certain people who have low vision. For them, it's been known that sometimes tinting their lenses help to improve their contrast. Contrast is how they are able to differentiate an object from its background in terms of the brightness. Yeah, so there are certain people who some of these things do help, but it should not be a wholesale, like you should go for a tinted glasses before you can drive. If you don't have an issue, you don't have to actually go for that.
Okay, 0541022318. That's the number to call. We're talking glaucoma, and I'm chipping your eye questions too as well, so that you can get some free consultation here. But what Kobe said earlier, that he would sleep and wake up with a lot of eye discharge to the point of using a towel. We'll come to that in a bit. Let me pick this call. Hello, good morning.
Hello, good morning.
Yes, you're welcome to Health Lounge. Yeah.
How are you?
I'm fine. How are you?
I'm also fine. I want to ask about thyroid eye. I was given this medication and I started taking it, and now one of my eyes is bigger than the other. And the doctor said it's thyroid eye. I want to know what causes it. Can it be corrected, and by what means?
Okay. All right. Thank you. Yes.
So there are certain systemic conditions like hyperthyroidism.
Yeah.
Okay, hormones that are produced inside the body. They have effects on the eyeball. So the eye is housed in a socket. Okay. So if you look at the skull, there is a hole that houses the eyeball. There are some fatty tissue around it. People who have high levels of thyroxine or people who are hyperthyroid, these hormones stimulate the tissue within that socket to grow very fast, and that will push the eyeball out. So if you kindly Google maybe thyroid eye disease, you see exactly how the eyes look like. Some of them, they will have their eyes protruding. When they close their eyes, the eyelids are not even able to close the eye very well. And this is also one of the conditions that can cause a secondary kind of glaucoma, because fluid again cannot drain very well away from the eyeball. So it's a condition that is not as a result of the eye drop that you used, okay, but it's as a result of the abnormal levels of the thyroxine hormone. So people who have goiter, okay, they'll have this swelling in front of their neck. If that gland is producing too much of the thyroxine, one of the signs is that you have certain complications on the eye. So the eyeball becomes big, the lids will retract back so that you are not able to close the eye very well, and your eyes will feel very dry. Okay, this is a condition that also needs prompt attention. Your physician who is taking care of you needs to control the thyroid level very well, and your ophthalmologist, during the time that is being controlled, your ophthalmologist will ensure that the exposed part of your eye is protected. Otherwise, by the end of the disease process, you end up having ulcers or sores on the surface of the eye, and even scarring of the surface of the eye that can impair your vision. Or sometimes, like I said, it's also associated with certain secondary, a secondary increase in the eye pressure that can also permanently damage your optic nerve, what we call a secondary glaucoma.
Okay, so
it's not from the eye drops.
It's not from the eye drops. Okay, so she may have a secondary condition that is causing this. Yeah. Okay. A listener had sent me a private message, and his concern is that there are a lot of, well, the word he uses is quacks, but I don't say quacks. There are a lot of poorly trained people who claim that they also take care of people's eyes.
Okay.
And he's saying that some of these people claim that they can cure blindness.
Yeah.
So he wants to find out from you whether some type of blindness is curable, and if it is anybody at all who can cure that form of blindness. This one, they want to know from you. Yes.
Yes. So there is some forms of blindness that is curable. Blindness from cataracts is curable.
Okay.
Yes. And that one is not everybody that can cure blindness from cataracts. It requires specialized surgery to cure such blindness. Okay. And then also, so we have visual impairments, we have blindness. Blindness from cataract is curable. For visual impairments from refractive errors, it's also curable with glasses.
Okay.
Yes. So basically, those are some of the few conditions that can be cured.
Okay.
And I think I'll add. I mean, that's the reason why we have this glaucoma week, where we are raising awareness. Scientifically, it's been known that people who are permanently blind from glaucoma, we cannot reverse it. Okay. So if the blindness is from glaucoma and all that, yes, people are desperate. People want to be seen. That's where the quacks will take advantage to fill in those gaps. What I would say is that if someone has lost the vision so much in an advanced glaucoma disease, doctors will not say we cannot treat you. There is still some treatment for you, and that's what we call the low vision rehabilitation. There is still something. Even those who are end stage, permanently blind, we have rehabilitation services for you that can help you to be able to cope. Of course, we cannot perform that miracle of bringing back the vision. Doctors will tell you the truth. The quack will tell you what you want to hear, or because of what they want from you.
Okay. All right. Efia wants me to find out from the team, saying, are there any particular foods that can improve eye vision for people?
Yeah, generally, any food which is balanced enough that is good for the body will also be good for the eye. But specifically, generally, foods rich in fruits and vegetables that have lots of vitamins. Okay, so like carrots, mangoes, and all that. They are very good for the health of the eye. So for the surface of the eye, for the back of the eye, the retina, the optic nerve, all those foods are generally very good. When people ask me, I generally tell them that whatever is good for your health will also help your eye as well.
Okay. All right. That is okay. So, Kwabena, I'll ask you a question for you, but okay. 0541022318 0541022318. People still keep asking questions about purulent eye discharge. There's another question that someone is asking about purulent eye discharge of his child. He also says that this happens in only one eye, and says people have asked me to try salt and so many other things. He says that she's tired. Yeah.
So for the eye discharge, it can be from various causes. Okay, it could be an infection of the eye conjunctiva. Okay, it could also be for a blockage of the nasolacrimal duct system, which is usually common in kids as well, especially when they have a catarrh.
Okay.
Yeah. So generally, basically, you just have to take it to the eye clinic, so that the doctor would decipher what exactly is causing it, and then give you the appropriate treatments.
Okay. There's this question that's, this one, they are bashing the eye clinic, saying that the Confirmation Eye Clinic is always so packed. It is difficult to go there for a consultation. What's happening there, guys? Your place is always packed.
Yes. But we are trying to streamline things in terms of appointments.
Okay,
So
okay.
the situation has been that almost everybody comes in with a referral, and because this is the second, largest tertiary hospital, we get referrals from all over Ashanti, all the regions above So it is understandable, all right. That means that before your condition actually comes to Confanoche, it should be really necessary. You should be referred. However, we have lots of walk-ins, and I think that's an area where we are looking at so that we can be able to dispose some of the not so complicated eye conditions to some of the peripheral facilities to handle, so that Confanoche can handle the really complex ones. Then in that case, we can be able to work on the waiting time for patients. I do understand. Sometimes even we as workers, you go to work early. Sometimes you leave as late as 8. So in as much as we empathize with these patients, we are also at the other end suffering because, of course, who wouldn't want to come to work and close at 3?
Of course.
And go and spend time with their family.
Of course.
Yeah.
Hey.
Just that at Confanoche, when you come, we really take time to see every patient. Whatever
that's true.
that we need to do, we go to every length. All right. So we don't just rush through patients. That's why. So our patients who are given appointments, please let's try and stick to the appointment, because when you miss your appointment and you come, you deny others the opportunity of being seen early enough and well enough. I think that's a general problem that we are trying to tackle.
So, my guy, go there or just go and book an appointment. Pick a date. If it's a non-emergency, book an appointment. Pick a day and go. And yes, they don't work on Saturday and Sunday. They don't work on Saturday and Sunday. He says, put Saturday and Sunday there, we will come. Don't worry, they will go and just see you small, and then they'll see what happens in that field. 0541 0223 18 0541 0223 18. General question. Someone is saying that Apollo has gone down. What did you guys do to eradicate Apollo? Hey, we are talking about glaucoma. He's saying that he hasn't seen Apollo in a long time. What did you guys do to Apollo?
I think it's a seasonal thing. There's a season that it comes.
Okay.
And it's a viral infection. So when there is an outbreak, usually we alert the public so that they'll take certain precautions.
Okay.
When someone gets it, what is most important is what they shouldn't use to treat. Because it's a condition that will go on its own.
Okay.
If you are very uncomfortable, there are certain recommended symptomatic treatments. But certain people will go to the length of applying things like seawater, breast milk, and all sort of concoction that will later permanently damage their eye. All right. So during the season of Apollo, we do give public education. People should take those things very seriously. But when the time is up, it will come.
When Apollo decides to come, kindly find your ways into the studio and let's do a conversation on Apollo. So, guy, you heard, it's seasonal, all right, and it's a viral infection. So, there could be a viral outbreak at a particular time, and then everybody's up and about Apollo and all those things in between. Yes, you're listening to the Orange Out Lounge. You're talking to Dr. Loretta DUOPA and Dr. Louise OTENG GYIMAH, and you're talking about glaucoma. They have rounded up beautifully on everything that you need to know about glaucoma and everything else in between as well when it comes to your eyes. And they've told us that they're doing public education, and then they're also doing screening at Confanoche, and then for Louise at JACHIE. I'm sure all the other optometrists and ophthalmologists and ophthalmic nurses, all those who work in the eye space, will be doing something this week. If you've heard something that you're curious about, just go there and go and have that checkup. If you're above 40, go and check. Go and check.
Must.
It's a must. Don't take it lightly at all. Justice is saying that are all eye conditions hereditary? Saying I'm asking because he says I wear glasses, I have bad eyesight. My wife wears glasses, her eyesight is not better. Our first child wears glasses because we noticed that he has challenges. He's saying that we're expecting a second one. Should we buy glasses automatically? Just as you're funny.
Yeah.
So what should so are certain eye conditions hereditary?
Sure.
Yeah.
Eh.
Some of the, even for the disease that we are talking about, glaucoma, I said that if there is a family history, the risk is high. When it comes to wearing of glasses, like for short-sightedness or long-sightedness, the hereditary component is also very, very important. It doesn't mean that all your children are definitely going to need, but then their risk is high. Okay, but then let me just chip this through. Wearing glasses doesn't mean your eyes are bad per se. It's just because the length of your eyeball may be longer than what it should be, or maybe it's shorter than what it should be. So when your eye captures an image, it doesn't fall at where it should be to give you that sharp image. So the glasses only modulates the light ray so that it forms the image right on the retina for you to have a sharp image to your brain. All right, so there's nothing wrong with wearing glasses. Actually, wearing glasses even mechanically protects your eye, and from certain injuries like I talked about earlier. I started wearing glasses when I was in senior high school. Until then, I didn't know that I wasn't seeing well. I thought the way I was seeing, that was how everybody
sees.
was seeing until a particular time when I didn't get a front seat I'm always used to. I went to the middle and I couldn't see the board. I went to the clinic and I was told I had refractive error. And with my glasses, my vision really improved. And I think it changed so many things about me. It helped me even in my academics as well.
Yeah.
All right, so that's why we have been emphasizing have regular eye checks. We don't have a national program where, I mean, people are routinely checked. But until we get there, let us make it our personal responsibilities. Because good eye health is actually everything. If you can see well, you can do well.
So, okay, so somebody's asking that if you're living with a relative who unfortunately has gone blind from glaucoma or has very impaired vision from glaucoma, she's saying that ask your doctors, besides medication, how do we help such a person to cope with life?
So that is what we mentioned about the low vision rehabilitation. We have such services available at Confanoche and at JACHIE. Where where the person is taught how to navigate the environment and to cope with the condition. So there are various other devices that can probably help to improve the vision. But apart from the devices too, there are other things that they'll be taught to do in their house just to help them to navigate.
It helps to make sure that the home has it's safe for the person to walk about. That will be difficult too. Even when there's light of eye struggle.
And again, I think for those of us who have people like that, my auntie was blind from glaucoma. It's very difficult living with such a person. So I think empathy on our part is very important. Sometimes those of us who are helping them, we become overburdened. Because the person has to depend on you even to use the washroom. So, and we also personally have our individual stresses. Maybe you are in school, you are working, you have children to take care of, and your in-law or somebody who is staying with you cannot see at all. It really requires a lot of, emotional strength so that we can empathize with these people. All right, because it's not their doing. It's not their doing. So in addition to these services that may be available, these rehabilitation services, we need to be kind to such a person because we can all find ourselves in that shoe in some time to come.
All right. And we're not picking any more calls on the show. I'm going to allow my doctors to wrap up. So in wrapping up, any final words before we run away from the studio? Yes, Dr.
So the final words for glaucoma, like we said, causes irreversible blindness, but it doesn't mean that you become blind. The key is that it is detected early. Once it's detected early, then blindness can be prevented. Okay. So everybody should have their eyes checked. It is very important. If you have your eyes checked and you are fine, it doesn't mean you should stop. You should continue checking at least once a year, once every 2 years, because it can get it later in life.
Okay.
In Ghana, we have a very high prevalence. We are all at risk. So it's very important that we all get our eyes checked.
All right. Important. Louis.
I think my colleague has said it all to end. I should say that those who have been diagnosed to have glaucoma, we are one of the fortunate, because there are many others like us who are not even aware that they have the condition. So if you are aware, or if you have been told, let us please stick to the advice of our doctors and comply to the various treatment options that are available. And I'm sure together we can prevent blindness from glaucoma. Even though we cannot prevent glaucoma, we can prevent a world that is blind from glaucoma. Special thanks again to Orange FM for giving us this opportunity to enlighten the public, and also to the Ophthalmology Society of Ghana, leadership of Komfanochi Teaching Hospital, and the eye department, our bosses, Dr. Ampon, Dr. Frimpong, Dr. Ekins, and all the other hardworking staff, and also staff and management of Anglican Eye Clinic at JACHIE. Special greetings to all of you. Thank you very much.
All righty. And that brings us to the end of today's show. I am positive that you have learned something on the show today. Apologies earlier, there was a small challenge with the sound, but I got fixed midstream. So I'm sure you heard everything that we discussed. We're back on your radio next week Saturday from 8 a.m. to 10 a.m. here on Kumasi's Music Leader, Orange 107.9. My guests have been Dr. Louis OTENG, GYIMAH, and Dr. LORETA, DUOPA. Have a beautiful week, and don't forget to check yourself into an eye clinic and have your eyes screened. Show ably produced by Alisa Davina, and enjoy the rest of your Saturday. Goodbye.